The following are some general principles and staff responsibilities in the self-administration of medication. Resident safety is most important, and the key to safety is preventing medication errors. When in doubt about a medication, always call the physician or pharmacy first. Upon admission, contact the resident's physician to verify all current medications, dosages, times, and instructions, and check all medication labels for accurate information. Document medications on a medication log or centrally stored medication and destruction record log. A sample of this type of form can be accessed in the Attachments tab in the top right corner of your screen. Always read drug labels carefully and follow the order and instructions. Residents must have a physician's order for all self-administration of any medications, including prescription and non-prescription medications. Be aware of family or visitors bringing in any non-prescription or over-the-counter medications, such as regular Tylenol, cold or allergy medicine, vitamins, or herbal supplements. While these items may seem harmless because they can be purchased over the counter, it is important to remember that many of these may counteract or have serious negative side effects when mixed with prescription drugs. Non-prescription medications in a residential community setting should be treated no differently than prescription medications and requires a physician's order and documentation on the facility's centrally stored medication log. Avoid keeping a house supply of over-the-counter medications for any resident in the community to use. This is generally prohibited and can put the residents at higher risk for medication errors. Talk with the resident about their medication and pay attention to any complaints or expressions of concern they have about their medication. For example, if the resident expressed ill effects from the medication, get more specific information and notify the physician right away. If the resident tells you the medication does not look like the one he or she normally takes, do not offer the medication. Recheck to make sure you have the correct medication or contact the pharmacy. Avoid pre-pouring medication. This means do not pour medication ahead of schedule for your own convenience. Best practice is to assist with pouring the medication for the resident around the scheduled time for that medication. Prepare medication in a well-lit and clean area, preferably a designated medication room. Avoid distractions or rushing while handling the medications. When distractions occur, make sure to recheck everything to ensure the medications being offered are correct to ensure resident safety. Ensure the correct medication is for the right resident in the right dosage, right route, and the right time. We'll review the 6 rights later in this module. Assist medication one resident at a time. Stay with the resident to ensure she or he takes the medication, don't leave it for the resident to take it later. Some medications should not be taken together with juices, milk, or certain fruit or food. Water is the best fluid to use with oral medication unless explicitly otherwise directed by the pharmacy or physician on the label. Never leave medications out unattended. If the resident does not want to take the medication now, let your resident know you will return in a few minutes and place the medication back in the centrally stored location. Do not replace unused medication back into the bottle. If the resident refused the medication or dropped it on the floor, you will need to destroy the medication and document why the medication was missed. Then, follow your facility's policy regarding incident reporting. Practice the fundamental principles of infection control. Wash your hands with soap and water or any other sanitizing method recommended by a medical professional, local health official, health department, or other research-based medical authority, and the resident's hands before assisting them with medication. Do not touch medication with your bare hands. Gloves may not be used on multiple residents and shall be properly discarded in between completing an interaction with one resident and prior to an interaction with another resident. The gloves must be removed and discarded in an appropriate waste receptacle with a tight-fitting cover. Never relabel the medication bottle or alter the prescription label. If the dosage or time has changed, a new prescription is needed from the physician, and a new bottle or bubble pack is needed from the pharmacy with the new dosage information. Keep current and accurate drug records at all times. Don't wait to document later. Document right away to ensure accuracy. Never share or give one resident's medication to another resident. This is illegal. Always observe residents for changes in condition and be aware of any changes that may alter their physical or cognitive ability to self-administer medication. As soon as such changes are identified, report the changes in the resident's condition right away to the physician and to the responsible party. Avoid verbal medication orders from the physician due to the resulting high risk for medication errors under these circumstances. Request the physician instead contact the resident's pharmacy for an e-prescription as well as faxing a copy of the order to you for the resident's record. Contact the pharmacy for follow-up to ensure the order is placed and that timely receipt of the medication can be arranged. A medication error is defined as any preventable incidents that may cause or lead to inappropriate medication use or patient harm while the medication is in the control of the healthcare professional, patient, or consumer. Never cover up any medication errors, and if an error does occur, always follow your state regulatory guidelines and facility policies on incident reporting. When warranted and depending on how serious the medication error is, the resident may need immediate emergency medical attention. Avoid running out of medication by noting when medication is running low and follow facility policies and procedures on reordering and refill requests to ensure the resident doesn't miss any medications due to your poor planning. If the resident does miss a medication because the facility failed to ensure a refill was received in a timely manner, the facility could be subject to citations and civil penalties, and the incident should be treated and reported as a medication error.